Now, good afternoon, Mr. Edwards.
Good afternoon, my lord. This evidence session is evidence from Mr. Neil Craig, who has worked for many years as a porter at the Glasgow Royal Infirmary, and he's giving his evidence as a union representative for Unite.
Very good. Thank you, and good afternoon, Mr. Craig.
Good afternoon, my lord.
So,
Yes, Mr. Edwards.
yes, thank you, my lord. Mr. Craig, could you give your full name to the inquiry?
Neil Thompson Craig.
Yes. And you have worked as a porter at Glasgow Royal Infirmary for 25 years, is that right?
That's right.
That's right. And you're also a union representative for Unite?
That's right.
Yes, that's right. Now, do you have a copy of your statement in front of you? Online? Good.
Not yet, it's not on yet.
Is it not? It is now.
Thank you.
Good. So you have that in front of you. Have you had an opportunity to read over it?
Yes.
Yes. And you are happy for that statement to be published?
Yes.
Yes. And for your evidence today to be recorded and published?
Yes.
The reference for Mr. Craig's witness statement is SCI WT 0118, 5 zeros and a 1. Now, if you could begin, Mr. Craig, with just describing briefly what your duties are, or indeed what a porter's duties are in a hospital, as you do in paragraph 3 of your statement.
So, my main duties is taking patients from department to department for x-rays, theatres, collecting blood samples, collecting waste, delivering prescriptions. Basic lift and lay between departments in the hospital.
And those were the duties that a porter would have had before the pandemic?
Yes, same duties.
And more or less continued afterwards?
Aye.
Yes. And you worked as a porter at the Royal Infirmary in Glasgow throughout the pandemic?
Yes.
Yes. But you sorry, when did you become a Unite representative?
So I became a Unite representative in January 2020.
Right, so it's literally just before.
Yes.
Yes. All right, very good. Now, your witness statement, as most of them are organised around a number of themes, and what we're going to do is just look at some of those themes. And the first theme is the first learning about COVID and the sort of first impact of it when we began to see what was happening abroad and when it first hit Scotland. And then we'll move on to issues around PPE, which we'll spend some time on. So, I mean, can you remember when you first learned of the outbreak of the pandemic?
Probably just in the news in Italy, I think it was at first, so we'd learn about it in the media. So now, that was probably February.
Yes, February 2020. But in paragraph 6 of your statement, you describe the sort of first response of the hospital that you remember when a COVID-positive patient arrived.
So the first patient I remember in the GRI was a patient that had been on holiday and been transferred to the GRI. Mm-hmm. So when that first patient came in, like they came in after the ambulance, there's everybody around about them had serious PPE, masks, like hazmat suits. Mm-hmm. No, we couldn't get clear. The only thing we had to do was make sure the corridors and the lifts that patient was going to go through to get to the ward was all clear. So we didn't need to go near that patient at all at first.
Mm. So there was definitely a sort of response to the unknown, if you like.
Yes. It's like it made you feel safe at the time because of the precautions they were taking.
But things quickly changed, you say, in paragraph 7.
Yes, I saw that in that ward that patient was, he was in a side room, they were in a side room, the door was always closed, and then gradually through the week, the door was open to his room. the PPE that staff are getting into the room sort of reduced to like a surgical mask and then sometimes none.
Now, that brings us to PPE, which you begin discussing at paragraph 8. So, at the before the pandemic, what sort of PPE would a porter normally have, if any?
Before usually for a patient, I'd say for an MRSA, you'd wear a mask and gloves and apron, just for that patient if they were confirmed. But then for any other patient, we wouldn't use any PPE at all.
Yeah. And at the beginning of the first lockdown, so March 2020, did that change?
So at the beginning, it's sort of, you would wear a mask, PPE, it was changing day to day at first, and then it was changing if you had a patient that was confirmed COVID, then it was contact COVID. So basically you didn't really know at first if the patient had COVID, so you didn't wear a PPE. You were only doing it when it's COVID.
I mean, you say in paragraph 9 that in the initial period, so after this first experience when great precautions were taken, then it relaxed, and now we're moving into the initial period, sort of March 2020. You say in paragraph 9 that the default position was that patients were getting treated as if they did not have COVID.
Yes, with no symptoms. If you had no symptoms, you didn't have COVID.
Yes. And obviously there was no testing at this time. No. Now, in paragraph 10, you say that you remember collecting a patient from a ward to take them to X-ray. And you say that they were feeling sick, and you gave them a sick bowl. Now, did they think they had COVID? I mean, what do you remember about that?
Well, I don't know if at the time any of the staff thought that patient had COVID, but I had to take that patient from the ward to the X-ray, and they didn't have any PPE. I didn't have any PPE because obviously they were getting treated as somebody who didn't have COVID confirmed. They weren't confirmed at PPE at the time.
Yeah. And what you say in the next paragraph is that you remember this because the hospital opened a COVID ward the next day.
So the next day, that's when we had normal wards, and then that day, that's when we first experienced a particular ward getting open for COVID patients only. And that patient was one that I pushed the first day, was the first patient in that ward.
Yes.
So obviously that was a bit upset about that.
Because you thought you would now be
Yeah, I
exposed.
thought there was a great risk of me catching COVID because
Yes.
of the contact I had with the person.
Now, you explain that you live with your family, you live with your partner and your daughter, and in paragraph 12 you raise the issue of provision that was made or not made for staff that might not want to go home to their family.
So at that time I was aware that there was the opportunity for surgeons and nurses to get put up in a hotel instead of going home with their families at the time. Mm-hmm. They could put up at a hotel, but that never extended, in my knowledge, what I remember, in my experience, it never extended to porters or facility staff, domestics at the time.
Right. I mean, if I can just explore that with you for a moment, what you're saying there, it is one of the themes of your statement that there was an unequal treatment of certain staff compared to others, and at the moment we're focusing on the beginning of the pandemic, the first lockdown, but what you're saying in paragraph 12 is that clinical staff were offered the opportunity of not having to go home, but the domestic staff, as you call them, including porters, were not.
So I never had any communication about that offer being made to porters or domestics.
Right. So just to be clear, you're not saying that it was definitely the case that someone was that were not offered that, but your recollection was they were not.
That's the way I remember it. I'm not saying it definitely, but just I remember that. Well, I don't remember any communication that was extended to the porters.
And you don't remember ever being offered that possibility?
No.
Now, again, at this time, certainly no PPE was routinely offered to porters.
No, so at that time, that's when PPE was still what type of patient. It all depends, but it was confirmed COVID contact, but it was still basic. We never had at that time that we had to wear PPE with every patient, so it was still unsure.
And what you say in paragraph 13 is that it is possible that PPE would have been offered to porters if there was a confirmed COVID patient.
Yeah, well, if it was the PPE was there to use, if it was a COVID patient confirmed, but at that time there's still no testing. So the only way of confirming the patient at that time was probably when we take the patient up to CT scan, and that was where most patients were getting confirmed at the time during their CT.
And you wouldn't routinely be told if someone was or was suspected?
When what happened then was we took that patient to CT, the nursing staff up in PP were a bit angry about you turning up with a patient. It's no good. The patient didn't have the mask on either, and we didn't have a mask. So they were a bit annoyed about us turning up with the patient without PP on for them or us.
So when you say that after April 2020, porters began to be issued with PPE, are you saying that this was only in relation to when a patient was suspected of having COVID?
That's when they started. At that time we were asking, could we not just wear PPE with every patient? Because we knew that patients were going up there to get confirmed that they had COVID.
But in relation to masks, we'll return to masks in a moment, but in relation to masks, at this point, masks were not routinely issued?
No.
To porters, that is?
So but they could get them. It's all just about confirmation of a COVID patient. If it was confirmed, you definitely got one. And if it wasn't, you didn't need one.
Yes. Now, in paragraph 14, you discuss the union's response to this, and you say you remember one Friday. I mean, do you roughly remember when that would be? Would that be in April 2020 as well?
That was in April. That would be sometime in April 2020. So
by which time you'd been the union rep for 3 months.
Aye. So in that paragraph, that's me talking about that. I went to a meeting for a full day of meetings with a manager to tell the facility staff the guidance of what PPE was expected to wear. So at that time we were told, that's when we were getting told that you wear PPE, masks, gloves, aprons with every patient. But then later on that night it sort of changed. Some porters went up and they get told they no longer didn't need to wear the mask face to face, because they weren't face to face with the patients. They were walking with patients at arm's length.
Yes.
But that's me talking about then. I contact James and Esther to see if that's the guidance or to get their guidance and whether that had changed or anything like that, because to my knowledge it hadn't changed for Friday afternoon.
Yes, but this was a meeting at which it was explained to you how PPE was going to be issued.
Yes. I had to support the managers in that meeting to say, like, the union rep was there, and I was there to support the manager, but she was what they were telling people. You need to wear a glove, mask, aprons with every patient now, and then it changed later on that night.
Yes. Excuse me, my lord, if I could just take instructions on one small point for a moment. Yes, my lord, I just wanted to make clear that Mr O'Connell and Ms O'Hara have already given evidence to the inquiry, as my lord might remember. So what you're saying is that those representatives, along with yourself at the hospital, were instrumental in organising this meeting. Is that what you're saying?
Yeah, James was, yes. James was obviously a full-time rep, and Esther was a convener at the time, so they're senior reps to me. That's where I was getting my advice, getting asked to support management, because it would obviously settle staff's minds if they have the union rep there to support the management and they're agreeing with they're getting told.
And so what was the follow-on from this meeting then?
That meeting went well on the Friday. As I say, I just basically just was there to support the management at the time and back up everything they were saying. But then the follow-up was the Friday night, some porters were getting told they didn't need. So when I went into work the next day on a Saturday morning, like, I couldn't understand why there was a change when I'd spent the full day on the Friday supporting management to tell them that we need to wear the masks at all times now, gloves and aprons, and then it was changing. But then that Saturday, I quickly phoned James, contacted James, and James got it all cleared up that the guidance hadn't changed and the porters were definitely still wear masks. For that day on, we always wore masks. Every patient.
What you explained in paragraph 17 is that following the meeting on the Friday, a porter had experienced being told by another member of staff that they didn't have to wear a mask.
Aye.
Yes. But it continued to be the case that the availability of masks was a bit erratic.
At that time, it was definitely, that's when there was a wee bit of masks are out of date, boxes of masks might have been out of date and stuff like that. There was all sorts of things. That was when there was availability wasn't great.
Now, you also say in paragraph 20 that some of your colleagues were unhappy with these arrangements and refused to do their job.
Aye, so whilst they were getting told that there was no need for them to wear masks, then the porters were contacting myself or other union reps, and our advice was the guidance hasn't changed. You need to wear a mask. It doesn't matter, no matter if any nurse or any doctor or anybody was saying that you don't need to. That isn't formal. We get told to wear masks, and that was it.
And insofar as there was confusion around this, the impact of that on you and your colleagues in the domestic staff, if I can call everyone out.
That, for us, that impacted, made you feel a bit angry. You could see that there was a lack of masks here, and then we were the ones that's getting asked noted that we didn't need. There was a change, that we weren't to wear them anymore. We didn't need to wear them. But obviously we knew that nothing really had changed.
So I think what you're saying is, as you remember it, of course, that insofar as there were problems with the supply of PPE and in particular masks, there was a prioritisation of the allocation, which porters didn't come out of favourably.
Yes, because I mean we didn't we have porter's job is you have face to face with the patients, but it's not for a massive community amount of time.
Yes, I mean I think you say that you were there was an issue in paragraph 18. Just going back a little bit, in paragraph 18, you say that one rationale for porters not needing to wear masks is that they were pushing patients from behind.
Yes, at arm's length.
At arm's length. Sorry.
That was it. That was it. That was the scientific evidence that I get dealt at the time.
When you say you were told it was scientific evidence, who told you that it was scientific evidence, or where did that information come from?
Now that came from one of our management team. They said, and it was the guidance did change daily, so and it was a fluid thing. It did change daily, so that's what they were saying. That the guidance has changed for the day before.
And then you say in paragraph 23 that the issues around PPE added to the general anxiety which staff were suffering.
Oh, definitely, definitely.
Now, when in paragraph 24, what you describe as fit testing for FFP3 masks, so I think what you mean by that is that FFP3 masks would be issued and would be tested on people to see if
Aye,
they
so
fit.
you had to get tested to see if they fitted you properly. So at round about April, some of the porters that were based in the E&E department, they got fit tested for them. But as I say, they never. That was for patients who were on ventilators or getting oxygen at the time. But we never came into contact with the patients because the ICU staff or high dependency staff actually moved the patients themselves. So even though some of the porters were fit tested for them, they never needed to wear them because that, in my opinion, that was a good decision. That minimised the amount of people that was actually going near the patients.
Now, when PPE did become more readily available and broadened out to all members of staff, you raised the question in paragraph 25 of training issues, the availability of training to use PPE. Remembering that historically porters would only use it rarely, if at all. So when it became widely available and people were expected to use it, so obviously there's a danger of people not using it properly. So what were the issues around that? So
the PPE, there's actually a way, an order where you put the gloves and the aprons on. So before that, we were probably never aware in a proper way putting PPE was on. But we had the earlier patients, MRSA patients. But then there was guidance came out. There was an order you would put all your PPE on. There was an order how length you would keep a mask on. If your mask became damp, you had to change it. If you went into the ward with a clean mask on, you had to take that off. Or you went with a mask on, you took it off and put a clean one on. If you went into a patient's room, you took the one you want and put another one on, a different one on. So every time you came into another space or another area, you changed your dirty mask for a clean one, and you hand sanitised it as well. So we got trained how the circumstances where you would change your PPE.
Now, you say a little later in paragraph 27 that certainly by the time of the second lockdown, full PPE with surgical masks was provided to every porter.
Oh, at the time the second
so by
lockdown.
November 2020.
Sorry?
By about November 2020.
So the first, I think, first lockdown's finished in August, and then time even in August, even for then August, we were always wearing, even when the lockdown was finished, we actually still wore PPE with every patient, gloves, mask, apron. And by that time we knew how often to change it as well.
Yes. But what you say is that you say that, as you feel it, the worst period was in between July, August 2020 and November, the end of the first and the beginning of the second lockdown, that this was the worst period. Well, why do you say that?
Because for me, that was the worst period because we had a rise in staff that actually had COVID numbers. There was, by this time, COVID patients, there was a great amount of COVID patients in the hospital, but we had normal patients, I was just saying normal, we had the normal everyday patients returning into back to the hospital as well, so the capacity in the hospital was up, and that time I've got my members that wear shielding, they're coming back to work. So the vulnerable patients, the vulnerable staff we had after the first COVID lockdown, they're starting to come back into work. So that bit there has been prevalence about the hospital with COVID staff and more COVID patients. It was greater than it was at the start, like April, May wasn't as bad as.
Yes, I mean you're right in that the statistics do show that there was a rapid increase in August, September 2020 of people getting COVID and going into hospital. So what you're saying is there was a significant increase in patients coming into hospital with COVID and a significant increase in the number of your colleagues getting COVID.
And probably a significant increase of people catching COVID in hospital.
Now, you then turn in your, well, is there anything else on this point that you would like to say about PPE at this moment before we move on? Is there anything else you want to
No,
say about PPE?
but then PPE is fully understood when we need to use it and what items we need to use.
Well, your statement then turns to the impact of the pandemic on shift patterns, so work shift patterns, and we just wind the clock back a little bit to the outbreak and the beginning of the first lockdown. So you begin in paragraph 28 by describing the pre-pandemic situation, that certainly in your case you would work about 48 hours per week, albeit some of that was about 10 hours or so of that was overtime.
Aye.
That was the routine position. And you say that, interestingly, that as you remember it, at first your colleagues as porters were not getting COVID or not catching it.
No, I know at first, because when at the start, a lot of reporters, because we were essential workers, we were going to work. We were lots of people were going to work. Obviously, you're reading media, and it was like well done. You're going to work. This is your duty. So a lot of reporters were going to the working, and the managers didn't know the impact of COVID at first. How the capacity in patients that was going to be. So they thought the workload was going to be higher.
Yes.
So we were all there, and we could be there as long as we wanted to be, really, because people weren't unsure if you were going to be needed. But it turned out we weren't really needed.
So people were coming to work. They weren't getting COVID at the beginning, and the shift patterns at first stayed the same. But there was, what you're saying is, there was a significant fall in the amount of work porters had to do.
Definitely.
Yes.
We didn't have the capacity in the hospital. A lot of patients, obviously, they discharged out of the hospital, either at home or care homes or other places.
And
They didn't do theatres, they didn't do scheduled elective surgeries or anything like that. So, the workload was definitely not as bad.
And that's partly because you explain in paragraph 30 that the medical block was less than half full. By the medical block, you mean where preparing for theatre, or?
No, medical block would be like your everyday general medicine patients. So
Right. So that
we were
reduced.
used to the wards being full of capacity most days, but then you'd go into the wards and they were like half empty, half full, whatever you might look at.
And so people, in paragraph 31, you see people were still coming to work, but a long period could pass before a porter was asked to do a job. Yeah.
Because of the amount of workload wasn't the same, and because we had that was the best time we were well staffed in the hospital, because people felt it was their duty to go to their work and work through it, and we had lots of free downtime.
But then, from sometime in April 2020, admissions to hospital of COVID patients increased.
Aye.
And did that mean the workload increased for porters?
So gradually the workload would increase, but it would still
Or return to normal?
it still wouldn't be anywhere near as a normal day, because you've not got elective surgeries on, you've not got clinic appointments, so you've only got people that seriously need to be in the hospital and emergency theatres.
And you go on to say that as more COVID patients were admitted to hospital, the designation of COVID wards changed. There didn't seem to be any, as you put it, I'm putting words in your mouth, I don't want to do that, but there didn't seem to be anything systematic about the designation of COVID wards.
No, that was definitely, that was a thing that changed, maybe changed through the day. You would get, so if one patient had COVID in a ward, then that ward would now become a COVID contact ward. So you could no longer put patients that didn't have COVID into it. And then if that get confirmed as most patients in that ward was COVID now, then it become a COVID ward. So wards were changing it. Sometimes it would change. You go in the morning, it was now a COVID ward, but by the afternoon it was now a COVID ward because somebody tested positive.
And what were some of the communication issues around that?
So that was the she wasn't communicated to reporters, domestics or anything like that. You wouldn't know. You were going into a COVID ward at first because you didn't get told
Until you went in.
until you went in. Aye.
Now, of course, we all know that many people died in hospital as well at this time, and one of the responsibilities of porters is to move deceased patients,
Yes.
which is the next subject that you turn to in your statement. Now, again, before the pandemic, what would be the protocol or the procedure in relation to moving deceased patients?
So a deceased patient we would take to the mortuary department. If they were in ICU, they would be in a body bag. But if they were not an ICU patient, they would be wrapped up in a sheet, in sheets, and we'd take them to the mortuary.
And how long would a deceased person normally stay in the mortuary?
So,
Or was there a general rule?
probably, in my opinion, I'd probably maybe 1 to 2 days. It all depends how full the mortuary was at the time, probably.
Now, at the outbreak of the pandemic, or a few weeks into the first lockdown, the practice changed in relation to deceased patients, didn't it?
Yes, so as we go in a few weeks into the pandemic, then deceased patients were all going in a body bag. So they would all go into a body bag. And then if you further on into the pandemic, it'd be double bagged. The patient, a COVID patient, would be double bagged.
When you say further on, I mean, what do you mean by
So
that?
probably maybe a month later into it.
Right, so May or something like that?
Aye, May
2020.
May, June 2020, you would be double bagged by then. But a patient would be, all patients would be double bagged.
Right, so even if it wasn't established that someone had
Even if it
COVID.
wasn't established.
Right, so the practice then was to put all patients into a bag and then shortly after to double bag patients,
Aye, sure.
deceased persons, yes. But that didn't continue consistently either, did it?
No, because there was a time where patients were coming, they were just in the one bag, they weren't double bagged. When we'd take them down to the mortuary, we'd be asked to take them down to the mortuary, but the mortuary attendant was asking us to, can you make sure they're double bagged, because funeral directors, the guidance by now was to double bagged, and the funeral directors wouldn't take the patient for the mortuary unless they were double bagged. So that meant the mortuary attendant, she was double bagging them, she was putting them in a bag herself. So, which is quite a hard task to do.
Yes, so at some point the practice or the recommendation to double bag a deceased person wasn't being followed.
Wasn't it?
And the porters were taking that person to the mortuary, and it was up to the mortuary attendant to do that. Yes. And part of the reason for that was because funeral directors were refusing to take people who weren't double bagged.
So the funeral directors, the guidance did say double bagged, but the funeral directors, they will stick to that guidance. They wouldn't take the patient out of the mortuary unless it was double bagged.
I mean, how did this work in terms of space in the mortuary? I mean, was there a sort of backup, or?
So, in the mortuary, I'm only speaking to the mortuary attendant, she would tell me this, that the mortuary would be full, and she would need to contact the funeral directors. You need to get this patient out of the mortuary to of your funeral parlour, wherever it is you need to take them. And then because of the double bagging, so she didn't want to have a delay, she would double bag them probably, so not to cause that delay. That's the reason why she would do that. And that's the reason why she would ask us not to leave the ward with the patient unless it was double bagged. So,
I mean, as a porter, you will be familiar, I would have thought, with how this resolved. I mean, when did this problem resolve?
that didn't actually happen for long. That only went for a week, and probably the fact that mortuary funeral directors wouldn't take the patient, and we then porters when they leave the ward without the patient double bagged probably helped. But then, so that was only for a week.
It was only for a short period.
A short period of time.
Right. You then turn to the exposure for porters to COVID, and what you said earlier was in the first lockdown there didn't seem to be a significant incidence of COVID amongst porters where you were working.
Because then again we didn't have the lateral flow test and anything like that. We didn't people. You could have COVID and be asymptomatic. So
yes.
there was no porters at the time turning up to work with symptoms or were off with COVID up until probably, as I say there, end of July, August.
Sorry, go on. I was just going to turn to paragraph 41, but I think you were going to anyway.
My first recollection of a porter turning up to work with COVID was in August 2020. And this porter was actually an agency staff, so he didn't work for one department. He worked between two departments. So he worked with the casualty porters, and we called them the pool room porters. So a lot of the staff were in contact with that porter at the time.
Now, by this time, we weren't in lockdown between August and October 2020, and what you're saying is that the incidence of COVID amongst porters increased at this time.
Definitely. And
the union's advice, you say in paragraph 42, was that porters who tested positive or had symptoms of COVID shouldn't have any contact with patients. That was the union's advice. That
was not just union rights. That was probably the guidance of porters were at their work. Porters shouldn't be at their work if they had COVID at that time.
Right, but as you remember it, that was not the management's position.
No, at that time, that porter is being to their work, then normal guidance for all the other departments were if there was a member of staff who contacted who was COVID, then everybody being in contact with that porter or member of staff was meant to be off-site.
Yes.
Occupational health advice was to leave work, go home, occupational health will contact you, yes. Go through this checklist to see if you're all right to go back to work.
And is that what happened?
With the porters, no, we get asked to stay there, and COVID and occupational health will contact us that day. So my advice at that time, and we were asked to still push patients until occupational health confirmed that you could go home or stay. But my advice that day was, and obviously phoning James for James's advice on it.
That's James O'Connell.
Aye. We weren't to push any patients until occupational health confirmed that we were to be still at work.
Yes. And in paragraph 45, you maintain that generally, so not always, but generally, porters were never sent home if they'd been in contact with an infected colleague, whereas other departments were getting sent home.
Aye, so in that incident there, we had 2 porters that get sent home that day, 2 porters out of probably 15, 20 that came in contact with that porter had COVID confirmed.
And you say that the decisions, and just to be clear, the period we're talking about now is when there was an increase in incidence of COVID, so this is in the second half of 2020.
Yes.
Yeah. You say in paragraph 46 that the practice of not sending staff off-site was one that led to an increased exposure to COVID?
Definitely, because we were come in contact with porters or domestics, other staff that had confirmed COVID, and we weren't getting. So there was a checklist they would ask you if you'd been 2 metres away, had your mask on, but then it was your manager asking these questions, so there was an element of, for me, an element of staff maybe not telling the truth when it came to, because they thought there might be consequences. But that's when definitely the rising porters catching COVID, that's when it came. But then we were coming face to face with not just COVID porters, staff members, but more patients with COVID as well.
Now, by this time, of course, there was more guidance on shielding and risk assessments. And so what you say in paragraph 47, where you turn to this, is that in and after October 2020, there was a rise in shielding porters.
The rise in shielding porters are back at their work.
There was a rise in shielding porters returning to work. Now, why was that?
Because, after the first lockdown, it was like the government guidance was like lockdowns over, people that were shielding can return to go back to work. So the staff members that were shielding, guidance was that they could return to work now. So they were back at the work between probably October, November, I think.
And there were COVID risk assessments in place by this time.
So they would get risk assessed when they were meant to come back at the end of lockdown. And that was just a phone call off a manager. They say, like, ask a few questions. They say, are you okay then? You come back, all right to come back to work.
So what you were saying, the risk assessment was done by a manager?
Yes.
And not by an occupational health qualified person?
No, not that, no. That was in the end of August. Between start August and end August, these shielders were getting their phone calls. Right, you've had your risk assessment, you can go back to work. Remember, the prevalent then, there was no lockdown then, so there was meant to be COVID was meant to be was going down.
Yes. So, I mean, again, we're talking about this period when the incidence of COVID increased amongst porters, so it's after the first lockdown, before the second lockdown. People who'd been shielding during the first lockdown were returning to work more significantly, and any risk assessment that was done between them and a manager.
Yes.
Yes. And not by an occupational health person.
No.
I mean, and you say in paragraph 50 and 51 that you consider that to be a fault of the arrangements.
Yeah, in my opinion, yes. And then in that period, that's when I know there's staff with underlying health issues that were shielding, but now they're not shielding, and the prevalence is starting to rise again in August, September. And then I was actually concerned that they weren't getting risk assessment. Well, the risk assessment has started back again to send them back off, but then they weren't getting done properly because they weren't getting done with somebody with medical knowledge.
With the qualifications to do it.
Aye.
Yes. And in fact, you do discuss one practical example of this, don't you, in paragraph 49, where someone with a COVID age of 99 was determined that he could still work.
Yeah, I witnessed he took me in, he asked me to come with him to do his risk assessment. I witnessed the manager doing the risk assessment. It came back as age 99, and you could have there was guidance if you were 99, basically you shouldn't have left your house, never mind be at your work. And then the porter was told that, again, because he was pushing patients from behind the patient, and it was arm's length, then he would be okay to go back to work. But that's been, for me, that's the most concerning week in my experience.
And while this was going on, in the next section of your statement, you do mention that you and your colleagues experienced a colleague porter dying.
Yes, aye.
This would be in November 2020.
Aye, so it's all within the same week or 2 week period. So Porter passed away. The risk assessments we're getting, again, the prevalence is, again, is high up in society, The porter passed away. Risk assessments are not getting done, in my opinion, of by the right people. Correct, by the right people. And then there's another porter same week ends up in ICU as well.
And in fact, there were 2 incidents quite close together within a month of each other of a porter dying, is that right?
One porter passing away and another porter in ICU.
Yes. Now, at this time, you also say there was this would now be the start of the second lockdown, there was a significant increase in the number of agency staff doing domestic jobs in hospitals.
So there was an agency staff. There was a 4 Nations agreement where they would get enhanced cleaning in the hospital. So obviously they employed the agency staff there. We didn't have full-time substantive posts for that. So they applied, and there was a great rise in the amount of agency staff that did domestic work because it was fully funded on this 4 Nations agreement.
But there were problems with agency staff because they weren't familiar with the hospital, is that right?
Aye, so it was great that you had these agency staff, but the supervision of them wasn't great because obviously there's too many for the amount of supervisors that were there in the first place.
Now, when do you say things began to settle down, began to return to some sort of normality?
So,
from the point of view of a porter,
for normality, I think by the end after Christmas that year was probably when everything started to settle down.
When you say that year, do you mean 2020 or 2021?
2020.
Right, so during the 3rd lockdown.
Aye.
Yes.
Aye. I think by then, when you get into the 3rd lockdown, you quite clearly got PPE sorted, when you wear it, who you wear it with. The tasks that we were doing was all back to normal. Again, I don't know if there was some elective surgery going on then, so it felt more normal and we were doing whatever we were meant to be doing.
You do then turn to the post-pandemic or the post-lockdown impact on the health of your colleagues, and you say in paragraphs 66 and 67 that there has been a significant increase in health terminations of employment.
Aye, so in my role as a union rep, I need to represent people in some of these attendance management things. But when I was representing members in attendance management meetings, it was like, how can we help you? The people were off sick because they were waiting on appointments that they couldn't get at clinics. They were waiting in maybe some surgery things that they couldn't get in clinics. So the reason they were off work longer was down to because of the NHS's the backlog and obviously getting seen, getting treated. So there was a couple that get terminated ill health terminations because of that. So they couldn't confirm a date when they'd be back at work because they didn't have a date when they were treated.
Has that had an impact on staff levels amongst porters?
Well, probably long-term sick in the days was a lot higher percentage. Maybe you could probably look back in some reports, and long-term sickness levels is probably 10-15% at the time. The staff off work.
And the current levels of staff amongst porters, has that returned to normal, to pre-pandemic levels, or?
Similar. It's probably no. I'm a union rep, so always want more staff.
Now, as many witnesses to the inquiry have said, there have been significant mental health impacts on people who worked in many roles in hospitals and care homes during the pandemic. And you also identify that. I mean, is there anything particular you want to say about mental health impacts, either in your own case or others that you know or represent?
For mental health wise, there was people that were on shielding for a long time, and then were coming back to their work. And when they come back to their work, obviously, they've got their fears and anxiety. They were shielding for a reason. They've been shielding because it's not been safe to go out in society, for their benefit. But then all of a sudden, it's all right to mingle with the everyday society, work. So these people were definitely still anxious, even though it was deemed safe to go back into society, but they still had their anxieties about it.
Now, you've been giving your evidence today to the inquiry as a union representative, but you also, in paragraphs 70 and 71, describe a personal experience that your family had. And this would be with a healthcare issue, with healthcare during the pandemic, and specifically cancer care of your father, I think.
So my dad got diagnosed with cancer in December 2019. So he had his first couple of episodes of chemotherapy, and I think he didn't get his last two appointments because obviously lockdown came in. So he had to.
That would be the first lockdown.
First lockdown in March.
So the last two appointments.
So he didn't get his last two sessions of chemo because of it.
And why was that? They were cancelled, or
they were cancelled because obviously lockdown came in, and obviously he's going through chemotherapy thing, so his immune system's been compromised. So he wasn't allowed to go out because of the lockdown. So that was the lockdown was a benefit to my dad because it probably kept him alive, or the risks, reduced the risks of him keeping it. But it wasn't great that you couldn't see your family, your dad, when you had to.
Yes, and he as a result of not being able to get the last two sessions of chemotherapy.
I don't know how I couldn't tell you the impact of that really.
Was he living on his own? Or?
No, he lived with my mum, so I couldn't see my mum and dad. I'd take him to every appointment, so I no longer could really see him.
No.
Because until lockdown finishes in I think it's June or July, I can't remember. So even though I was a key worker, I could go out to push other patients about the hospital or anything like that. I couldn't actually see my dad, and he was a patient.
Yes. Well, finally, Mr. Craig, you turn to lessons to be learned, and you make a number of points. Of course, you've already made a number of important points about the importance of, in your view, what you say about risk assessments being done by occupational therapists. But is there anything else, or occupational health qualified persons, is there anything else you would like to say about lessons you would hope to be learned from the pandemic?
So I believe they probably would learn this lesson anyway, but about all the PP that was needed and when we needed it and what type of patients we needed it. If there is a pandemic in the hospital again, I would expect everybody that being automatically wearing masks, gloves, aprons with every patient. Don't even take the risk, whether if it's a COVID patient or a no-COVID patient. I think the thing about the increase in domestics, I think we learned that the hospital wasn't as cleanliness as we needed. That's in how we had to get an enhanced cleaning. And I think why we reduced that So are we prepared?
Reduced it after the end of the
Aye,
lockdown.
aye, so why have we reduced that after the end of the lockdown? Are we no better keeping that hospital clean enough for during a pandemic? Should no always be like that? And obviously just the occupational health,
Yes.
like risk assessments getting done off, but management they didn't know if not get any medical background, and they've got a position of keeping they've got a what's the word I'm looking for? They've got an interest in keeping porters there.
Yes, of course.
They've got an interest in keeping staff there. It's going to impact, they know the impact yet. So it'd be better done by somebody who's independent or like an occupational health.
Yes. Well, I mean, you've made that point forcefully throughout in a number of places in your statement, and certainly again in paragraph 75. Now, Mr. Craig, your witness statement as a whole, along with your evidence today, will stand together as your evidence to the inquiry. I mean, is there anything else you would like to say or add before we close?
No, I'm just grateful to get a chance to give my experience as a union rep and a porter. So, that's it.
Well, I'm very grateful for the evidence you've given and for the effort you've put into the preparation of your statement, and I thank you for that. My Lord, that completes Mr. Craig's evidence.
Very good. Thank you very much, Mr. Craig.
Thanks, my lord.
Good. Right, well, we're finished a little early, Mr. Edwards. I think, I'm not sure if the next witness is available yet, but if the next witness is available, the last witness, we could start that witness at, shall we say, 2:45. I know Mr. Gale's going to lead that witness. We could start it at 2:45 if that's possible.
I can ask, my Lord.
Very good.
2:45, yes?
If that's possible.
If it's possible, my Lord, we'll inform you, yes.
That's fine. Super. Thank you very much indeed.
Yes. Thank you.
Yeah, cheers.
Now, good afternoon, Mr. Gale.
Good afternoon, my lord. The last witness today, and indeed the last witness in this section of the hearings, is Miss Helen Goss.
Good afternoon, Ms. Goss.
She's connecting with us remotely from her home. Miss Goss, you've given evidence to the inquiry before. I think that was on the 2nd of November last year, when you gave evidence about the work of the organization of which you are a leader, Long COVID Kids. So we have all that evidence. Your details are obviously known to the inquiry, and you provided the inquiry for the purposes of today with a lengthy and detailed statement. The reference to that is SCI WT 112 and then 501. And as I understand it, Ms. Goss, as with the situation on the last occasion you gave evidence, you are content that that statement, together with the evidence that you will give today, in amplification of that statement, will be recorded and published, and indeed, as today's hearing, broadcast, and that will constitute your evidence to the inquiry.
Yes, that's right.
Okay. Now, you are obviously now somewhat familiar with the process of giving evidence, but I wonder if I can just remind you of one or two things before we start. You are here today principally to talk about the impact that long COVID has had on your daughter. And just to give some context, your daughter first contracted COVID in the first wave in 2020 when she was 7, is that right?
That's correct, yes.
She's now 11.
Yes.
And can I remind you, Ms. Goss, not to refer to her by name?
Try my hardest.
Well, if we can be careful. And simply to refer to her as your daughter. I know that may seem a little artificial, but please try to do that. Also, can I remind you not to name any other of your family members? And finally, you have in your statement referred to a number of medical professionals who have been involved in the treatment of your daughter at various levels. And again, can I ask you not to name them as we're going through your evidence? Now, as you explained the last time you were here, you yourself suffer from long COVID.
Yes.
And I think from my own knowledge of following the production of your statement, that this statement has been quite an effort involved quite an effort on your part to produce it, both, I think, physically and emotionally. Is that right?
Yes, I have found it incredibly difficult to write this statement, not only because of the difficulty that we've had over the last 4 years, but also because we were reinfected with SARS-CoV-2 in early December last year, and my cognitive processing has been really bad. So I was finding it very difficult to actually compose sentences. But we got there in the end.
Well, you did, and we are very grateful to you for doing that. Now, in your statement, it is divided up into various sections, which provide a narrative of you describing your daughter's condition by reference to certain time periods. You're aware of that, obviously. And you've largely confined your narrative to the period to the end of 2022.
Yes.
Now, you've done that so as to comply with the time frame that's contained within the inquiry's terms of reference, which takes us to the end of that year. There are certain references within your statement to your daughter's condition after the end of 2022, and we note those, but we are grateful for the way in which you've confined your statement. But all that said, the inquiry is very mindful of the fact that your daughter's condition, and indeed your own, is an ongoing one. So we are very mindful of that. Can I also indicate that in your statement you've included a section headed Educational Impacts. And I think we can find that, it's not necessary to show it at this stage, but we can find that at paragraphs 134 to 155. It's quite a lengthy passage in your statement. Now, we've obviously read what you said in that section, Ms. Goss, but as you know, my colleagues in the inquiry, working in what we call P4, are involved in considering the impacts on children and young people and their education. And they have been in touch with you, and it's my understanding that they have taken or are taking a statement from you to inform their investigations. Is that the position that you understand?
Yes, it is, yeah.
So today, it's not my intention, with a couple of exceptions, to look at that section of your statement. But the one area that I will ask you a little about is the extent to which absence from school has been an isolating factor for your daughter, and we'll come to that in due course. Now, as I've said, you provided a detailed progression of your daughter's condition up to the end of 2022, and this began with you, your then partner, and your daughter contracting COVID just prior to the first lockdown in 2020. And you tell us about that in your statement, beginning at paragraph 8 and following. And as I understand it, you kept, with the knowledge of that infection, you kept your daughter off school at that time, is that right?
Yes. We didn't know exactly what it was, but I had a suspicion that it could have been COVID-19.
Mm-hmm. Right. And do you remember for how long you kept your daughter off school?
It was only a week, because then we went into lockdown.
Yes.
So
that took over.
Sorry.
I'm sorry, I was saying that lockdown then took over.
Yeah, that's right.
Yes. As you say at paragraph 14 of your statement, your daughter's symptoms were initially mild, because I think both you and your then partner contracted COVID at the same time.
He had it first, and then my daughter started to feel a bit unwell, and it wasn't until a few days after that that I started to feel unwell. So it was like a succession of getting knocked
Dominoes.
down.
Yes. Okay. And but if one was looking at it in a comparative way, her initial symptoms were milder than yours. As I
Oh,
understand.
much so. Oh goodness, yes. If it had been in isolation, we would have barely thought she was unwell at all. She just felt a bit under the weather. She was still able to do some schoolwork and play a bit. You know, it was very mild for her.
Now, can we, in order to get a little context, and you do refer to certain of this information in paragraphs, paragraph 23 and 24. Prior to this, can I put it bluntly, was your daughter a sickly child?
No, not particularly. She had childhood illnesses in the past, but she'd always recovered just fine. So I wouldn't have called her a sickly child, no.
Was she active?
Oh, very active. She loved swimming. She had swimming lessons all the time. We went swimming a lot. We played tennis occasionally. She loved that. But her main hobby, the thing that she misses the most, is that she has been horse riding since she was about 4 or 5 years old. So she can't do that anymore.
And could you also tell us about her school attendance? Was that relatively normal prior to
it was prior to the pandemic. It was relatively normal. We did have a small bit of difficulty in her primary 2. Turned out that she had a condition called pandas, which we didn't know at the time, which actually interestingly got triggered again by COVID.
Yes.
But you know, she had a lovely friend group. She really liked the school. She was always quite happy there. There were no concerns.
Okay. Now, what you do tell us in paragraph 14 is that your daughter, 3 to 4 weeks post-infection, took a very sudden turn for the worse. Can you just describe what that turn was?
Oh my goodness. That was honestly the scariest time of my entire life. And that is not even an exaggeration. I remember we were just in the sitting room watching TV, and all of a sudden she just gets up and says, "I'm not feeling well," and then took herself upstairs to bed. That was really weird for her. Anyway, and it happened really quickly. Within a few hours, she had a wild temperature and she was feeling feverish, hot and cold. She was feeling really, really unwell, and it came so out of the blue. I had no idea what on earth was going on. Anyway, so you know, she stayed in bed, and because she was so ill, I stayed up all night next to her, and she was shivering and sweating, and it was really scary, really scary. And it just carried on the whole next day, and then she wasn't wanting to eat. She wouldn't drink. A rash developed on her upper arms, and later on other parts of her body. And my immediate thought was, oh my God, is this, meningitis or something? But I did, the glass test and all that, and, it's fading. I thought, okay, well, but her temperature wouldn't come down. I was giving her Calpol regularly, according to the instructions, of course. But it wouldn't budge. It just would not come down. And I remember at the time there had been some rumblings in the news that you shouldn't have ibuprofen if you even suspect it might be COVID-19 related. And I was desperately trying to figure out, what on earth could this be? We had COVID. We had it like a month ago, 3 or 4 weeks ago. Can you get it again so quickly? What on earth is this? So because I didn't know what it was, and because the news was telling us, don't use ibuprofen, I didn't give her any. I was too scared that it would make her even worse. Turned out later on that actually ibuprofen was the only thing that would bring her temperature down.
I think
anyway,
sorry, can I just interrupt that? You did seek advice from NHS 24, I think.
Yeah, I did. I didn't delay that. I did seek advice from them, and they didn't seem too concerned. And I was trying to emphasize how severe this was, whatever this was, and you have to remember as well, back in that sort of era, I suppose, right at the beginning of the pandemic, it was very much an environment of fear. We were told, don't go to your GP surgery, don't go to the hospital, save the NHS, all of these buzzwords and slogans. So I was frightened to take her anywhere. So yeah, I called 111, and I described all of her symptoms and everything, and they said, okay, well, can we see if she can go to the bathroom? And I really don't think she can, but they were insistent that she had to go to the bathroom, and my daughter was, she was almost delirious at that point. There were some times when I couldn't even rouse her from her sleep. It was so frightening. Anyway, I tried to encourage her to get up. Said it's really, it's really important that we try to go to the bathroom. She was, complaining and say, I don't need to go to the bathroom. I don't feel well. Let me sleep. Anyway, she did. She got up with some help.
Can I just interrupt? Can we just get this in a little context? This came on 3 to 4 weeks after the initial contracting of COVID that you've told us about. In the period between contracting COVID and this onset, had your daughter recovered or apparently recovered from COVID?
Yeah. Yeah. She, when we had COVID, it was really mild for her. Mm-hmm. She was fine. Yeah. We thought we got off lightly. Yeah. I was almost glad that we'd had it. I thought, oh well, maybe that's it, over and done with now.
I don't mean
we all came through the other side.
I don't mean this as either a criticism or an insult. Was there any chance in your mind that your daughter was conning you about her condition? Well, you're laughing, but I think I can take
Because
it.
it's such a
Your
ridiculous
answer.
thing to say. No, of course she wasn't. She was incredibly sick when she had, it was 4 weeks after. When we had COVID, the acute infection, the reason we knew it was COVID was because of me. My symptoms were really awful. I had a horrible cough. I couldn't breathe. My oxygen sats were down at 91, 92, sometimes even 90. I mean, there was no mistaking that it was COVID at all. We didn't need a test to tell us that.
You do
even though
tell
there
us
was no testing.
you do tell us at paragraph 18 of your statement that you came across some information about a condition named pediatric inflammatory multisystem syndrome, which is temporarily linked to SARS-CoV-2. It's called PIMSTS. This, from what you say, was information which was reflected in the condition that your daughter was suffering. Is that correct?
Yeah.
You did eventually obtain a diagnosis of this. You refer to this in paragraph 19. This was a diagnosis provided, I think, by the Royal Aberdeen Children's Hospital, but it was qualified with the word suspected. So,
Yeah.
did you gain, albeit 2 years later, some satisfaction after of obtaining that diagnosis?
I wouldn't say satisfaction because of what they've put us through the last 4 years. I mean, I knew that's what she suffered from, and because they were hesitant to admit her, and so she wasn't assessed. You know, they said, well, we can't backdate her diagnosis because she wasn't assessed. And I said, well, that's absolutely reasonable, but the reason she wasn't assessed is because, you know, we were told not to come in at one point. I think that will forever be burned into my memory. Under no circumstances should you turn up at the hospital with your daughter. That's insane. I mean, if she was so ill like that right now, I'd call an ambulance. That's how sick she was. So I wouldn't say it was satisfying. It was frustrating. It was infuriating. I'm glad it's on her record now, but I get no satisfaction out of that because she was so ill. I honestly thought I might lose her.
Well, you do tell us at paragraph 21 that if your daughter had become horrifyingly unwell now, you wouldn't hesitate but to take her to hospital. Is that correct? Now, I'd like to ask you a little of what you say in paragraph 20, because this may be of some significance for the inquiry. You refer to an FOI request submitted by a member of the public and also evidence gathered by the UK COVID inquiry, revealing that organisations, including the NHS and the government, by which I assume that is a reference to the UK government, were very well aware of this condition. This is the condition PIMSTS, but had chosen not to inform the public so as not to panic parents. Now, can Can you just expand on that a little, please?
They, in their ivory towers, decided that they weren't going to tell the public that this condition even existed. Which I think is stupid, because if I'd known what she was suffering from, I would have taken her straight there. I wouldn't have hesitated. You know, the context of fear around that time, don't go near the hospital, don't, you know, save the NHS. I would have just completely ignored all of that and taken my kid to get a medical treatment. I'm just so... Sorry, it's really traumatic remembering it.
No, no. Take your time. Feel able to go on?
I just think if they had informed parents, then I would have taken her in, and it's very possible that she, with treatment early, maybe she wouldn't be so sick now.
Right. You do say in paragraph 20 that the institutions, including the government, had chosen not to inform the public so as not to panic parents. Is that something that you have seen in writing, or is that a supposition that you have made?
I'm pretty sure it's in the emails between people like Dr. Oh, I can't say their names, can I?
No, if you don't mind.
Okay. I'm pretty sure it's in writing, in emails between high-level decision makers in healthcare and policy and all of those areas.
Right. Okay. Can we move on, please, to... You all right? Yeah. Can we move on to the period that you describe in paragraphs 22 and following of your daughter's symptoms during the summer of 2020? Again, we can read what you say. Can we just again go back to, well, perhaps go to two expressions that you use, one in paragraph 23 and the other in paragraph 24. The expression in paragraph 23 is in the last sentence, and you say that your daughter had no fuel in the tank. And then in paragraph 24, you say that there was no spark in her. Again, can you just give us an indication, given her condition and the symptoms that she was displaying during this period, what do you mean by those two expressions?
She was just really, really lethargic. She was exhausted all the time. She didn't want to do anything. I mean, you know, we're lucky enough to have a back garden. She didn't want to come out in the back garden to do anything, even anything really simple. I did manage to get her out a couple of times, but she'd just sit in the shade with her coat on, and it was warm, it was summer, and she just looked like such a sad and exhausted figure. There was nothing to her. When I say there was no spark in her, she was just, you know, she was quiet, she was withdrawn, she wasn't herself.
And you give an indication in paragraph 24 of a number of sensory difficulties that she was experiencing, including that she couldn't have a bath because the water hurt her. And also she was sensitive to sunlight. So these were conditions that were impeding her obvious enjoyment of life.
Yeah, that's right. And it's difficult to, as a, not to say as a healthy person, but as somebody who doesn't experience these symptoms, it's really hard to understand how light and noise can actually be painful, physically painful. And I have experienced it myself with my long COVID. Luckily, I don't get it very often, but she gets it still every day. And it is very, very common in long COVID, and also PANS, which she was later diagnosed with. So quite often she has to stay in a dark, quiet room, very little sensory input. It's no life for a kid. It's very difficult to deal with.
Now, at paragraph 26, and I don't think it's necessary to look at the circumstances that gave rise to you asking for advice from a GP. But you tell us that the GP attributed her behavior to the fact that she had not been at school and that she was suffering from accumulation of isolation and anxiety. And you go on to say that the GP was very dismissive of her symptoms. Now, before we go on, one of the points I think you want to make through your evidence is the extent to which your daughter's condition was readily attributed to the effects of isolation and anxiety, and that any other cause of your daughter's symptoms were dismissed by certainly some health professionals. Now, is that what you want to convey to the inquiry?
Most professionals. In fact, pretty much all of them except one. It was a ridiculous time. Right from the beginning, I think people thought we were imagining it, making it up, that perhaps it was the effect of isolation and anxiety. None of us felt isolated or anxious at that time. It was a ridiculous conclusion to come to, quite honestly, and I didn't believe that was the case when the GP was suggesting that this is what the problem was, but I didn't argue with it. I know better now, but at the time I thought, well, maybe they're right.
Now, presumably these interactions with the GP were through you and remotely. Would that be right?
On the phone.
Yes. So there was not a physical examination of your daughter?
No, not at that time.
No.
There was later on when
Yes.
she had much more severe symptoms.
Yes. Okay. Now, the next period that you talk about in your statement is the paragraphs 28 and following. And this is the period between August 2020 and the end of the year 2020. You tell us that your daughter became very ill again in August 2020, and you tell us the symptoms of that. And you then took her to the GP, your GP, and subsequent to that, her condition worsened, and the GP sent her directly to hospital, the Royal Aberdeen Children's Hospital. Is that right?
Yes, that's right.
And one of the issues that you were confronted with then was that there had not been a diagnosis or a positive test of COVID at the outset of the pandemic in March 2020. And therefore, those who were interacting with your daughter indicated that you and they could not be sure that it was COVID in the absence of a test. How did you feel about that?
Oh, it was so infuriating. And, you know, this attitude lasted for years. Oh, you didn't have a test, so you can't know it was COVID. You know, basically completely undermining our entire experience. You know, we'd been I had been very sick with the acute infection, and then my daughter had been unbelievably sick with PIMS, and not treated. And then we go to seek help when she's really quite unwell again, and they're saying, no, we don't believe what you're saying, essentially. And I just, it's infuriating.
Can I ask you a question, please, about this? Sorry to interrupt, and I'm not seeking to be confrontational, but I want to be very clear. The language that you've just used, and you use in the final sentence of paragraph 28, and you say the hospital did not believe that we had COVID-19 in March. Now, I fully understand if that's the case, your irritation, anger, frustration in relation to the attitude. But I think you accept that it's a fact that there was no test, because there wasn't one, in March 2020. Now, from a clinician's point of view, do you accept that in the absence of a test, a positive test for COVID, the clinician would be, I'm not suggesting this is what happened, but I just want to be clear about that. There would be nothing wrong with a clinician saying, well, you report that you or your daughter had COVID in March, but in the absence of a positive test, we cannot be definitively sure. And we have to, in considering her condition at the moment, proceed on the basis that there is an undiagnosed report, or an unconfirmed, I beg your pardon, report of COVID some months ago. Now, can I be clear? That wasn't the approach they took. Is that your evidence?
Yes, that's not the approach they took. They were completely resistant.
They were completely resistant.
And
Do you accept that I'm right, that there would be nothing wrong with them saying we can't be absolutely sure that she had, or we can't proceed on the basis that she definitely had COVID without a positive test? You're saying that they didn't believe you, which is obviously a different thing. That's your position,
yes.
Is it?
They didn't believe it. I was clinically diagnosed, albeit over the phone, based on my my symptoms that I was presenting with, that were quite terrifying, quite honestly. When you feel like you can't breathe, it's not very pleasant. And my cough was really quite violent. It lasted for so long. Anyway, yeah, they were completely dismissive of it. Obviously, I understand as a medical professional, you have to exclude everything. You can't just assume that it's, you know, comes from one thing. You have to rule out hundreds of things. But they just simply wouldn't believe that we had it.
No, I apologise for pressing you on this, but you'll appreciate that I have to consider at the end of the day whether there's any criticism to be made of medical professionals. But I have your position, and you've explained it clearly, and I'm grateful for that.
Great.
Sorry, Mr. Gill.
Thank you, Helen. No, not at all, Helen. Just on that point, Ms. Goss, as I understood it from your earlier evidence, the situation was that it was your ex-partner who first displayed symptoms, shall I put it that way, of which we know, which you know, or now possibly even at the time and now certainly with hindsight, know to be those of COVID. You then acquired COVID, so you believe, so that there was, as it were, a history of the three members within your family group of having COVID at or around that time.
Mm-hmm.
Is that correct?
Yes.
And the clinicians that you spoke to at the hospital, were they made aware of that?
I said that, yes.
Yes. Okay. Now, could I take you on, please, to paragraph 35 of your statement? You mentioned there that your daughter's teacher raised certain concerns with you about what's described as uncharacteristic behavior. Now, just to understand the situation, when this occurred, do I take it that your daughter was back at school?
Yeah. So after that illness in the August, I pushed her, regrettably, to go back into school, and she was trying her best, and it was really difficult. Every day was very difficult trying to get her into school. She wasn't feeling well. She didn't want to go, but I was pushing her for the sake of attendance, which is, I wouldn't do that now, but at the time it felt very important to get her back to school after lockdown and be with her friends. And but then, yeah, I by chance met her class teacher in the community here, and she said, "Oh, I'm really, it's such a shame. It's such a shame to see her. She's so different. She's just not able to engage with her work. She's so exhausted. She's just, it's not her."
Right. Now, that prompted you to call the GP again. And again, there was an insistence that your daughter had anxiety. And as you put it in paragraph 35, she just needed to stay in school and would get over it.
Yes.
And again, you say the GP was very dismissive, unwilling to consider that COVID-19 was a contributing factor, and she made you feel as if you were an over-anxious parent. Now, is there any possibility that you were overreacting to your daughter's condition, or that you were being an over-anxious parent?
I really don't think so. And given the fact that 4 years on, she's much worse, I think if anything, I underreacted.
Okay. I think you indicate, if I can go to paragraph 37, that up to this point, your daughter had only been seen by GPs, who, as you say, had all minimized her symptoms, and only briefly by hospital doctors. But as I understand it, you are critical, and as you go on in paragraph 37, that the GP continued to refuse to refer your daughter onwards to pediatrics for further investigation, insisting that she was suffering from anxiety and nothing more. Mm-hmm. Now, at that time, were you arguing for a contrary view?
Arguing for what, sorry?
Were you arguing for a contrary view to the fact that what was being said to you was that your daughter was suffering from anxiety and possibly isolation?
Yeah, well, I wouldn't say I argued with the GP, but what I then did do is talk to the school about it. And I said, look, I'm not getting anywhere. You know, they just insist that she's anxious. And I guess I went to them for some advice and guidance, and it was the school who then referred her onwards to paediatrics, community paediatrics.
Yes. You tell us at the bottom of paragraph 37 that the school stepped in and referred your daughter to the community paediatrics and also to the Child and Adolescent Mental Health Service, CAMS. And that was in November 2020. How did you feel about that? Did you feel that that was a positive step forward?
Yes, absolutely. I was relieved that we were finally accessing a service. And it was definitely a positive move.
I think you tell us that the paediatrician who saw your daughter was, you put it, baffled by the numerous and wide-ranging symptoms that fluctuated wildly on a daily basis. That was the reaction of the paediatrician.
Mm-hmm. Yes. Quite reasonably, I think. I believe my daughter was one of the first, if not the first, to present with long COVID.
Mm-hmm. You then tell us that at Christmas 2020, this is paragraph 40, that your daughter's condition worsened, and it was around about this time that you came across, I think you say stumbled across, a small Facebook group called Long COVID Kids. And I think you've told us about that in your earlier evidence, but I think just taking that briefly, that for you was, as you put it, I think a eureka moment, discovering this group. Why was it such a significant moment for you?
It had been at that point about 9 months, and we didn't know what was wrong with her. We had no idea, and it was very confusing. Something clearly wasn't right, and we didn't know what to do and what it was. I was absolutely convinced that COVID had started this, because she was fine prior to infection, and then she got the infection, and then it all fell apart after that. So I knew, I was absolutely adamant it had to have been COVID that had triggered this, but I couldn't figure out what this was. So when I found this group of other families whose kids were experiencing such similar symptoms and difficulties getting into school again, and it was just a revelation. I thought, oh my gosh, you know, I'm not making this up myself. This is actually happening. It's happening to other people too. It was kind of a relief to realize that actually my instincts were correct.
In the section of your statement beginning at paragraph 43, which deals with the NHS medical intervention between January 2021 and June 2021, you tell us at paragraph 47 that after involvement of the pediatrician, who was not convinced that your daughter had long COVID, but she remained open-minded to that possibility. But you go on to say that in this appointment, your daughter was diagnosed with pediatric acute onset neuropsychiatric syndrome, PANS. Tell us just a little bit about that, please.
PANS, oh my goodness. Wow. It is unbelievable, this condition. 1 minute you can have a quiet child just doing something benign like drawing, and the next minute they are tearing the house down, screaming, trying to attack you. It's Jekyll and Hyde. It's impossible to describe PANS. He just went wild, sometimes with no apparent trigger. It was just all of a sudden a switch. And it was scary. You know, there were times when I thought that she had actually broken my bones. Everything in the house was a weapon to use. She was spitting everywhere, stuttering her words. It's horrifying to see. It really is. And it's all caused by inflammation in the brain. It's a treatable condition.
Yeah. You tell us that at paragraph 52, that you say this is a treatable condition with early diagnosis and treatment providing better outcomes. You feel that if your daughter had been treated earlier through the NHS, she would not have suffered for so long and may not be suffering to the extent she is today.
Yes.
That remains your view.
I absolutely believe that.
Yeah. There was another diagnosis made, I think, at or around the same time by the pediatrician, which was a diagnosis of ME, or chronic fatigue syndrome. And again, do you have a comment on that?
I'm not sure what you're asking.
Well, I'm just asking.
Can I comment on it?
Well, can you comment on, I mean, clearly you know what ME, chronic fatigue syndrome, is and what are its manifestations. Yeah. Do you feel that that was an appropriate diagnosis in relation to your daughter?
It was definitely a step in the right direction. You know, we do know now that around 50% of people with long COVID reach the criteria for an ME diagnosis, and my daughter is one of those. So I was, you know, content with that, but I still was determined to get the validation that COVID-19 was the root cause of this, and I wanted a long COVID diagnosis, and which they wouldn't give her.
Right. Could we move on to the section of your statement relating to private medical intervention? And you put this as a time frame of June 2021 to August 2021. It's paragraph 58 and following of your statement. Now, I know that in other parts of your statement, you talk about the need that you've had to engage with the private sector in medical treatment for your daughter. And if we could just use this point as a focus for that evidence, that I think, as you've indicated throughout your statement, has been a very considerable financial burden and pressure on you.
Yes.
So, and I think you've indicated that what you have had to spend has gone into certainly into the thousands of pounds.
Tens of thousands of pounds.
Yes. And what effect has that had on you? I'm talking about you yourself.
I'm skint. That's what effect it has on me. My savings are gone. I've got nothing to fall back on now. You know, if the boiler broke in the house, well, I really hope it doesn't, because I can't replace it. I have spent every single penny that I have had trying to find treatment to ease her symptoms, to help her, to give her a better quality of life. And I did find those treatments, but I had to pay for them. When I believe, and I believe this to be true, the NHS could and should have provided these.
I think you indicate in paragraph 58, and again, can I ask you not to name the individual concerned, but you contacted a consultant of pediatric immunology, and you had a remote consultation with him, and a treatment plan was put in place in relation to your daughter by him.
Yeah.
Now, how did you feel about that? This was, I think, in June 2021.
It was amazing. It was absolutely unbelievable. This clinician came highly recommended. He was extremely expensive, but God, worth every penny. He knew exactly what she was experiencing, exactly what she was suffering. He'd seen it before. He treated it before. It wasn't a particularly difficult case for him, I believe. Speculation, sorry. And he took an extremely thorough history. It was, wow, nothing we'd ever experienced before. And he started a treatment plan for her. And eventually, yeah, when she's been on this treatment for not even that long, a few months, oh my goodness, it gave me my daughter back. It was incredible. She was going from this so unwell, and having these insane meltdowns. I mean, terrifying, psychotic. You can't. I can't describe it. I mean, I literally have to lock myself in the bathroom so she wouldn't hurt me. It was terrifying. There were times where I wasn't sure who I should call, but I think I should call somebody, the police or ambulance. I don't know. Anyway, so he treated her.
I think, I don't want to go into questions about your private life, Ms. Goss, but I think by this time you and your partner had separated, is that right?
No, not by this time.
No. Subsequently you did, I think.
Yeah, and it was largely to do with this situation.
Okay. But I think coincidental with the treatment that you've been talking about, your daughter contracted the Delta variant of COVID. What effect did that have on her?
It made her worse. So by the sort of June 2021, although her hand symptoms were very severe, she was starting to improve in other symptoms. So she was slightly less fatigued. We were able to do a little bit more. she looked like maybe she was even potentially starting to recover somehow or somewhat, and then we got the Delta variant, and it just slammed her right back down again. Oh, it's so upsetting because when you start to see that light at the end of the tunnel, and then it just gets taken away so quickly like that, it's really hard to deal with, and it ended up making her even worse than she was before. So her cognitive processing just plummeted. You know, she had actually been able to do some online education up until that point, and she just wasn't able to do it anymore. She just couldn't focus, couldn't concentrate, couldn't understand what she was seeing on the screen, couldn't follow classes. The noise and the brightness of the screen and the online class were really overwhelming her and upsetting her and causing pain. It really just put us right back to square one, and even beyond that, it was worse.
There is one perhaps interesting part in, it's actually the second part of paragraph 59, that you quote a number of things that your daughter would say to you, which tend to suggest that she had an awareness of the problem that she was suffering from, and probably the problem that it was causing for you.
Yeah, it was very distressing for her. She couldn't control it when it was happening. The meltdowns, the violence, the physical attacks, verbal attacks. She couldn't control any of this, and quite often, actually, mid-meltdown, she would start crying and ask me to help her. And I didn't know how. All we did was I just held her. I just held her and just tried to rub her back and tell her she was gonna be okay. Don't make me start crying again. It was really, really hard. Yeah, she was aware that it was.
Well, let's possibly endanger you in crying again, because can we go on to the baby tigers?
Oh God, the baby tiger.
You mentioned in paragraph 63 and following that you and your daughter had been interested in news reports about a pregnant tiger at a wildlife park, I think it was in Aviemore, and you arranged that you and your daughter would go to see the tiger cubs when they were born. And I think you did that, and you tell us about the arrangements that you had to make for that. Was that successful so far as your daughter was concerned, going to Aviemore and to seeing these tiger cubs?
I think we have to define successful for us. I mean, we did it. And I guess it was successful in the way that we actually managed to get there. We actually managed to go see the tiger cubs, but the trip did have a harmful effect on her. She just was constantly having headaches and stomach aches, and she was so tired. Honestly, there were so many times where we nearly just turned right back and went home and thought, we just can't do it. But we carried on, and she really, really wanted to see the babies, so we kept on going. But yeah, when we got to see them, she just collapsed. and there were so many people there, you know, who wanted to also see the baby tigers, and yeah, she just collapsed, and it wasn't until a stranger said, "Why don't you get her a wheelchair?" And I was like, "Oh my God, I never even thought about that." So we did. We got her one of the park chairs, and we managed to stay there for another few hours and saw some other things because she was able. We could wheel her around, and that was so. It was successful in that sense, in that we discovered that actually a mobility aid was something that we could use to help her.
And I think thereafter you did in fact buy a wheelchair for her. You tell us about that in paragraph 67, and you tell us about the cost of that. Although it wasn't, as it were, a wheelchair fitted for her, it was just a wheelchair that was available, and you bought it, essentially.
Yeah, that's right. Yeah. We rented one initially because we really hoped it would just be temporary, but after 6 months we thought, you know what, we're just going to buy a really comfortable one for her, and but you know, it is important that you get measured for a wheelchair, but the pediatrics are very funny about mobility aids. It's not just us that have had problems with this. They say that it's going to make the child lazy or increase any deconditioning, and yes, well, that might be true, but you know, it's a difference between her sitting at home inside or sitting in a chair outside and getting some fresh air and sunshine. And the difference of opinion between the pediatrics and occupational therapy and physiotherapy, who are both very supportive of the use of a wheelchair, it was just such contradicting advice, and there still is, but we use it regardless, although she's too sick to use it now. It's actually the cats are using it as a bed.
Yes. Now, paragraph 70 onwards, you describe a period of observation of your daughter in Aberdeen Royal Infirmary, and it's quite a lengthy account, and I without suggesting any disrespect to you, and given the time, I think we can take what is in there as read. There's just one or two things I'd like to pick up from that. One of the points you make on a number of occasions in this section is that you were terrified that they, by that I assume the medical staff at the hospital, would accuse you either of Munchausen's or what is termed fabricated or induced illness, FII, at any given point. And I think you go on to talk about this more fully in paragraph 92 and following, that you felt that the consensus was based around your daughter having anxiety, but there were other contraindicators, and the focus appeared to be on the anxiety and education. Now, what was your reaction to these suggestions, or your view that these were being suggested of you, that you were engaging in Munchausen's or this fabricated induced illness?
They never came out and said it, but they were flinging around terms such as perplexing presentation and medically unexplained symptoms, which I found quite ridiculous. Just because they didn't understand it doesn't mean it wasn't happening. It wasn't unexplained. It was triggered by COVID-19. Just because they can't understand the mechanisms yet doesn't mean it's not real. And I think now that, you know, the more research that comes out and supports everything that we've been through over the past 4 years, I'm not concerned about that, us being accused of that now. But back at that time, there wasn't as much research. We frequently were not being believed about that her symptoms were that bad, and they were that bad. And it was very scary because, you know, you feel like you're on a knife edge at all times. And, you know, is there a possibility that they're going to try and take your child away? Because I know it's happened to other families whose kids have been had long COVID severely, and they've been accused of making their children ill themselves.
Can I put this to you?
Wild.
Did you feel that you were under suspicion?
I felt like I was under suspicion, yes.
And was that how you felt? Was that a suspicion that either you were exaggerating your daughter's condition, or that you were causative of your daughter's condition?
Both. I was actually told by another clinician, a CAMS clinician, who had never met me, never met my daughter. I'd only scanned the case notes, and told me on an online meeting that she believed my anxieties are making her sick. It's ludicrous. I'm doing everything I can to try and make her better. Recovery is the only goal. We still hope for recovery, and I have read every single research paper that is out there. I am trying so hard to make her better, and then they're accusing me of making her worse. Blows my mind. I mean, I just I couldn't handle it, actually. I burst into tears again. And
Well,
I just had to leave the meeting when they said that.
Ms. Goss, we can read the section which begins at paragraph 70 and goes on to, I think, paragraph 95, beyond that. Yes, 95, about the period during which your daughter was an inpatient at the hospital, and it was quite clearly, and I don't want to go through it with you because, as I say, we can read it, and I don't want to upset you, but it was clearly a distressing experience for you.
For me, but it was more distressing for my daughter.
Now, I'm conscious of the time. You have made a complaint to NHS Grampian, and again, we can read what you say about that. Begins at paragraph 99 and carries on to paragraph 115. There are just 2 points I want to take, and they're really factual matters from you. Paragraph 103, that after certain communications, your daughter was finally diagnosed with long COVID in March 2022.
Yeah, that took a lot of work on my part because they were very resistant, and so I turned it around back on them and I said, okay, will you tell me why you can't diagnose her with long COVID? Here's the WHO definition, here's all of, she ticks every single box, so you tell me what are the other conditions that you have not excluded yet. That means that you cannot diagnose her, and that they didn't have an answer, so they gave it the diagnosis.
You feel that was done reluctantly?
Oh gosh, yes. Very reluctantly. And we're not the only ones. There are so many kids out there who quite clearly have long COVID and are not being diagnosed with it, despite all conditions being excluded. There's a big reluctance to diagnose long COVID in children.
And the other point I want to take from you in relation to that section of your statement is that you have an ongoing legal action against NHS Grampian, which began earlier this year. We don't need to go into any more detail than that, but just as a matter of fact, you have begun a legal action in relation to the conduct of NHS Grampian.
Yes.
You've given us the section on the impact on your daughter and indeed on yourself. This is paragraph 1, 2, 3 and following. You mention in paragraph 1, 2, 4 something that I've already asked you about, that your savings are gone. And as you put it, you're skint.
Yes.
And you live paycheck to paycheck. So this has been, well, we're talking about obviously principally the impact on your daughter. This has had a very significant impact on you.
Yes, it has. Yeah. This is a bit where I'm not going to cry again.
Try not to.
It has. Yes, it has had an incredible impact on me. We've lost so much. We've lost our health. We've lost friends. You know, you kind of think that people might rally round when you're dealing with a very difficult situation, but turns out they don't. Yeah. So yeah, it's very isolating. It's very boring. Now
you say at paragraph 129 of your statement that you have involuntarily shielded throughout the pandemic and are still involuntarily shielding, mostly because your daughter is unable to leave the house.
Yeah.
And, is that I appreciate that's taking us up to the current time. Is that an ongoing situation that you are effectively shielding?
Involuntarily, yeah. I mean, we've had four COVID infections now, and every single one has made us sicker. So, you know, we can. It's never a linear trajectory. You know, it's you get the infection, get really sick, and then you start to maybe get feeling a bit better, then you get reinfected, you go back again, but maybe worse than before, then you start to maybe get a bit better, get infected again. The cycle continues, and each time you get infected, your baseline gets lowered, which is why I think I had such a horrible time trying to write this statement, is because after a fourth infection, my brain is shot. I can't process things anymore. I feel really dumb all the time. And, you know, we don't want to get reinfected a fifth time. So we do all we can to avoid it. We still wear masks. Well, she can't leave the house, but when I need to go out, maybe go to the shop, I'll wear a mask to try and lower my risk. But you know, she can't leave the house anyway, so we don't really see very many people. We have to rely on people coming to us, but turns out people don't do that.
We're coming to the end of the period of time we have for your evidence, Ms. Goss. There are just a few points I'd like to just ask you about further. Paragraph 131 of your statement, you talk about a disconnect between the Scottish Government, what the Scottish Government is saying and what is happening on the ground. And you say that the government is adamant that children are being seen and treated, and you say they are not. they're also saying that they've provided adequate funding to long COVID services, and you've said that the funding has been tokenistic and not guaranteed long term, so recruitment has been extremely challenging. There are currently no functioning long COVID services for children and young people in Scotland. Has that always been the case?
Yes. They talk a good game, but actions speak louder than words. And where are these services that we were promised in 2021? Don't have them.
The other point I'd like to ask you about is vaccinations, which you refer to, paragraph 132 and 133. Your daughter hasn't been vaccinated, is that right?
He hasn't.
No. And I think you took that decision having taken the view of the immunologist that you have been, who has been treating your daughter, who
I
didn't necessarily
asked for his opinion.
I'm sorry, he didn't necessarily say that it shouldn't happen, but cautioned against it. I think is possibly the way to describe it.
Well, yes, but it was a discussion, weighing up the risks and the benefits. He suggested that perhaps it might be a bit taxing on her immune system at that given time, so maybe just wait a bit until she's feeling a wee bit better. But vaccination eligibility for her age group was very short-lived. So even if I wanted to get her a vaccination now, I don't think I could.
Right. You provided us at the end of your statement, I've passed over the section on educational impacts for the reasons I gave earlier. You've given at the end of your statement a section on lessons to be learned and hopes for the inquiry. We can obviously read all of those. One of the lessons to be learned that you do highlight is at 165 of your statement, and this is in relation to infection control and prevention of transmission. And you say that we know SARS-CoV-2 is an airborne virus, and this has not been communicated to the public. The public are unaware of how to protect themselves. Now, we have heard in the inquiry some evidence of differing views on the means of transmission, but there seems to be now an acceptance amongst the experts that SARS-CoV-2 is transmitted by aerosol, not by droplet. So that is, I think, the point you want to particularly get across, that we should be more aware of that.
They knew that in March 2020.
Yeah.
This isn't new.
Yeah.
It just wasn't communicated.
Yes. Yes. And again, so far the hopes for the inquiry, I think, combined with what you've said earlier when you gave evidence and what you've said today, I think we can take what you've said there as read. You've also told us about documentation that you can make available through your solicitor. I think what I can indicate is that the inquiry will be in touch with your solicitor to ask for certain or perhaps all of these documents so that we can see them and they can be utilized in our work in the inquiry. So from me, Ms. Goss, I'm sure you'll be pleased to know, that is the end of what I have to ask you. Very briefly, is there anything that you feel that we haven't touched on that you would like to emphasize before we finish?
Do you know, I had written something that I thought I might read out, but honestly, I'm so tired, I'm exhausted, and this was really emotional. I just don't think I've got it in me. So I'm just going to bow out graciously, hopefully. and hope that I haven't embarrassed myself quite too much.
I'm sure you don't need to feel that, Ms. Goss, and I think we're very grateful to you for the evidence that you've given, the time that you've taken to provide this, and we do appreciate that it's not been easy for you. So, from the inquiry team, thank you very much indeed. Thank you, my lord.
Indeed, Ms. Goss, there is absolutely no need for you to feel embarrassed. Thank you very much indeed. And that's all of your evidence. That brings us to the end of the evidential hearings in relation to the health and social care impact section, portfolio 3, in this inquiry. Mr. Gale, I'd like to thank you for leading your team throughout this long period of evidence, which has spanned, I think, about 7 or 8 months now. I'm very grateful for all your efforts, but I'm also very grateful to your team, both counsel and solicitors, for all their efforts in this time, and also to the paralegals and witness takers and all the other backroom staff who assisted you in putting together, which has been an exceptionally complicated and lengthy piece of evidence, which I'm very happy to say, so far as I'm concerned, has proceeded essentially without a blemish. My thanks to all of you.
Thank you very much, my lord, and we are similarly very grateful to your lordships for his guidance and his attention that he has paid throughout to the evidence that we have led.
Thank you all. That's this part of the evidence hearings finished. The next hearing will be the hearing on Mr. Gale's submission in relation to this evidence, which is set for, I think, is it the 27th of June?
27th, my lord, yes.
27th of June. So until the 27th of June, that's adjourned.
Thank you, my lord.